Hello, this is Hugh Brewster, the Executive Director of Transforming Faces, a global cleft charity based in Toronto. And I'm also the host of Caring for Cleft, a podcast where we explore all the topics that are moving the dial forward on locally rooted comprehensive cleft care. This is an exciting moment in the development of comprehensive cleft care, or CCC, in East Africa. What makes me say that? Well, in episode 3 of Caring for Cleft, way back in 2019, we celebrated 2 pioneering CCC centers in Ethiopia and Uganda under the respective leadership of Dr. Mekonnen and Dr. George Galiwango. Today, the era of relying upon foreign volunteers to complete safe and effective lip and palate surgeries in this region is definitely on the wane. Local professionals are willing and able to fill the gap, and what's more, speech and language therapy is increasingly recognized as a critical health profession, and fledgling CCC centers are breaking new ground. In October 2023, I had the opportunity to travel to Addis Ababa, Ethiopia, where Transforming Faces and its partners hosted the first ever Speech and Surgery Collaboration Conference. Now, this podcast will be a 2-parter. In this episode, we'll meet 4 inspiring young professionals, 2 plastic surgeons and 2 speech therapists, who all participated in the collaboration conference as they build up CCC centers in Tanzania and Ethiopia. In the next episode, we'll get into the fascinating nitty-gritty of how a team-based approach to care is ensuring ever more children and families affected by cleft experience full rehabilitation. First up, let's meet Dr. Getaw Alamne, a surgeon graduate of Addis Ababa University School of Medicine who has been practicing plastic and reconstructive surgery for 2 years. Currently, he's part of the CCC team at Tegete 12 Hospital in Central Addis.
So what drew you to plastic surgery? Did you always know you wanted to be a surgeon, or is this something that developed along the way?
Well, I wanted to be a surgeon since grade 8. When I was grade 8, my father had a bowel obstruction and he had surgery, emergency surgery. So it was since that time that I made up my mind to become a surgeon, and with God's help, I am able to become a surgeon. Particular to plastic surgery, during my surgical internship, there was this team of surgeons that come from UK. They come for 2 weeks complex surgical mission. They did this complex head and neck surgeries at Tegete 12 Hospital. I was an intern back then. So I had the opportunity to see their surgeries, complex craniofacial surgeries, complex normal surgeries. Before that, I was dreaming to become a general surgeon. So attending their complex surgery completely changed my mind, and I was completely drawn into plastic surgery.
For Dr. Getaw, seeing his father receive specialized and life-saving treatment inspired his interest in surgery. From there, a chance exposure to a craniofacial mission led him to focus his career aspirations upon cleft care, where Dr. Mekonnen at Tegete 12 was only too happy to take this promising young surgeon under his wing. For Dr. Francis Tegete, it was training and mentorship at Korsu Children's Rehabilitation Hospital in Uganda, where Dr. Galiwango was the head surgeon, that unexpectedly led him to focus his plastic and reconstructive surgery in cleft care. Today, he is the leader of the first CCC team in Tanzania, where he's building a clinic at Bugando Medical Center in Mwanza.
Yeah, so I grew up in the western part of the country, whereby the health services is a little bit challenging. And then I went to the university in the city in Dar es Salaam. That was a medical school. And from the time I joined the medical school, my passion was to become a surgeon. I never knew what type of surgeon I was going to become until I joined Bugando Medical Center as an intern, and later on as a medical officer. I was the so-called registrar, whereby I was working in the general surgery department for a couple of years. And it happened that I became a pioneer for burn unit. And that's where my interest for plastic surgery started. And over the time, we used to have visitors coming for the missions, and they could gather all the patients for burn reconstruction together with the cleft And something new came up because attending the cleft patients is like a miracle. You just perform a surgery and immediately you see the changes. You can even see your mistakes immediately. But that was not enough.
A discipline that is rare in Tanzania, but which Dr. Francis saw the benefits of up close in his training in Uganda, is speech therapy. Research clearly shows that most children born with a cleft palate will greatly benefit from specialized speech support. Dr. Francis was determined to incorporate Adam Mang'ombe, who is among the first Tanzanian speech therapists, onto his CCC team. Adam started his career in nursing, but his passion for helping children led him to jump at the chance to pursue further specialization.
And by that time, actually even now, in Tanzania, there are very few speech therapists. I can say maybe less than 10 in the country of 60 million people. The origin of this idea of going to speech therapy as part of my father's study didn't start with myself. There was a time when the head of department of ENT of our hospital, by that time was Dr. Buname, wanted to have at least one speech therapist. And he shared this need with the director of nursing services of our hospital, who communicated it to me because I had already told her that I want to go for further study, but provided that it is relating to care of children. And therefore, I remember that time speech therapy was not well known among health professionals, especially in Tanzania. So I did personal intensive research about it. And I came to realize that a good number of clients whom I will be caring if I become a speech therapist will be children. Now, I started the process of application for Masters in Speech and Language Pathology. And toward the end of 2019, I started my Masters in Speech and Language Pathology at Kenyatta University, Kenya, because by that time there was no any institution in the country that could provide the speech therapy program. And that's how it started.
As with Dr. Francis, who had to study plastic surgery in Uganda, there aren't yet pathways to study speech therapy in Tanzania. Adam had to complete his program abroad. Keen Caring for Cleft listeners will remember episode 2, where we explored the circuitous but ultimately fruitful journey toward establishing the first speech therapy program in Ethiopia. Wedise Mekonnen is among the very first speech therapist graduates of that program. Now working with Cure Ethiopia and Addis Ababa, her career path took an unexpected turn. While attending a lecture on cleft lip and palate by one of the few speech therapists in a country of 120 million, her mind immediately went to a child she knew from her home village.
I was learning pharmacies, right? And then after pharmacy, I was between two studies. I studied speech therapy and I studied pharmacy. I didn't decide. But the moment I decided was when we first go to Ekatis Hospital for our lecture with Dr. Masai. And we talked about a lot of things. We talked about what Ekatis 12 hospital give for children with cleft lip and palate and how we get involved in speech therapy of cleft lip and palate. And so I know a patient from my hometown that have cleft lip and palate. Do they have speech problem? Is that the cause? Can I help them? This was my question. And I leaned back more into the cleft thing. So after that, we met a lot of patients with a lot of problems, and we solved most of the problem. We work on them, and I started to love speech therapy.
Okay, let's take stock of some of the key changes in East African cleft care we've charted over the past 5 years. In 2019, we celebrated the launch of the very first speech therapy undergraduate program in Ethiopia. This summer, we cheered on Wedise and her 15 fellow graduates of the very first master's level speech therapy program. Wonderfully, many of these budding speech therapists are pursuing careers in cleft care. You may remember that Dr. Mekonnen was sent by the Ethiopian government to study plastic surgery in Ukraine, as no suitable training programs existed in East Africa. Today, Dr. Getaw is among a bustling cohort of newly trained plastic surgeons who studied in Addis Ababa and have been exposed to the promise of comprehensive cleft care through internships at Tegete 12 Hospital. In Caring for Cleft Episode 3, we also highlighted how Dr. George was among the first locally trained plastic surgeons in Uganda. His department at Corsu has now contributed to the formation of excellent young cleft surgeons, including Dr. Francis from Tanzania, who are similarly committed to pursuing comprehensive cleft care. Clearly, the time was right for the first ever Speech and Surgery Collaboration Conference in East Africa. I emerged from this event inspired by the energy, enthusiasm, and commitment of a young generation of professionals, all pioneering new approaches to care. For me, it also underscored the multiplier effect of local cleft professionals as professors, as mentors, and as guides.
Dr. Mekonnen is a very polite person. I mean, I know Dr. Mekonnen since my undergraduate school because he was also my mentor since my undergrad school. So getting into plastic surgery also helps me to know him more as a surgeon and as a team leader also. Everything I do today, especially in cleft care, is because of him. He's one of the finest cleft surgeon I can say. He's one of the best.
For Dr. Francis, it was a tag team of Dr. George Galiwango and Dr. Andrew Hodges in Uganda that informed his vision to create the very first CCC center in the Lake region of Tanzania.
So actually, we are lucky to be a pioneer of comprehensive cleft care in the country. And actually, this came after the exposure. I trained in Uganda, and the place where I was training, we had at least, I can say, 75% to 85% of comprehensive cleft care team. And when I came back, I found it was only primary care of surgery and nutrition, and the rest was not there. And yet we are teaching hospital. We have everybody at the ground. They were just not connected and they were not aware of this. So I saw the opportunity and I really gathered people and the professionals by self-initiatives, like approaching one by one, convincing them, telling them what the importance of this, and thank God that they received me positively, and we started together. And the vision was we want to be the center of excellence in cleft care in the country, to not only do surgeries, but be able to capture all aspects of comprehensive cleft care, and moreover to be able to train others and also do a number of researches. Because we are in a region whereby a number of congenital anomalies in the country is high, including cleft.
Effective training closer to home is one part of the comprehensive cleft care story in East Africa. But what's keeping these young pioneers motivated and invested in finding new ways of working? I asked each of our guests about what stands out from their experience thus far.
I had this lady. I operated her kid, was around 6 months. It's a predominantly Christian society, but there is also this belief that this kind of malformation is due to, a sin. Or a punishment by God. So the baby was supposed to be baptized at the age of 40 days. But at the age of 6 months, the baby was not baptized. And she told me that she keeps the baby in the hideout. So in the morning, the first post-op day, when I removed the dressing, the mother cried in front of us when we make the rounds. And I asked her why she cried. She cried due to happiness. She told me that she is going to take that kid to the church for baptism. So that was, these kind of moments are kind of moments that I cherish and, directs me to dedicate my career in cleft care. So I just made up my mind. There is nothing that will make me happy than this kind of things in life.
I'm not a healthcare professional. My career has been in community development, having worked with large and small NGOs on issues related to poverty and equity and capacity building. But something that really appeals to me about Cleft Care is how solvable the limitations of Cleft can be for children and families. The families that Transforming Faces supports all face challenges related to their low-income situations in Africa, Asia, and the Americas. But our partners can and do make an impact on the intense burden of caring for a child born with cleft. I resonate with Dr. Getaw's assertion that seeing a child dramatically move from exclusion to inclusion, from poor communication to clear communication, from ill health to better health, this is a big win. For Adam, addressing some of the unexpected but devastating knock-on effects of a cleft diagnosis are what motivates him as a speech therapy pioneer.
For example, I remember there's one lady who reported that her husband has been complaining why their child, their little girl, she's always able to call her mom, but not able to call her dad. You know, in Swahili, mother is mama and father is baba. So you see, baba is what we call, it's a word from pressure sounds, which someone with cleft cannot be able to make. And mama is nasal sound. I mean, it's a word from nasal sounds, which people with cleft palate are able to make. So this lady was wondering, how can I help my husband to understand why the child is not able to articulate the word baba, but she's able to articulate the word mama? So I explained to her. I told her the reason why the child is able to mention the word mama and not baba. And I asked her to bring her husband to the therapy. And when they came together, I provided awareness and education to them, and we proceeded with the therapy. The child was improving, and eventually the child was able to say baba. And this was really amazing to the family.
In my travels for TF, I regularly hear about marital strife as a common consequence of having a child with cleft. This burden is often experienced differently by mothers and fathers. For mothers, members of the community or even their own family can communicate that they are somehow to blame for their child's condition, while fathers may feel community and family pressure to divorce their spouse and abandon the child to maintain family honor. It is always inspiring for me to meet parents who choose to push for the best for their cleft-affected child in unity. For Wedise, one such family provided her first clinical milestone in seeing a child move from unclear to clear speech just in time to attend school.
My first patient who got better with her speech, her name is Danat, and I was so very happy that I can make that progress on his child. And there was a communication between the surgeon and me to do a speech surgery and to get back to me again. And her parents were also very involved, so she made a very good change in a little bit amount of time. So I was very happy, and she was very happy. She was all over the place, and she even get me promoted to other people that in the way that I helped it very much, and I was a very good speech therapist. She used to tell me a lot of things, so I was very happy to do that.
Oh, that's lovely.
My work. This is what I say. Well, this is my work.
How old was Danat when you started working with her and her family?
She was 3 years old. She was about to be 3 years old, and she had a very glottal stop sound, and we worked for, I think, 8 months or something to we don't have nasal endoscopy at that time, right? So we only work speech therapy, and then she came for speech surgery, and we don't have speech surgery at this hospital. So I called with Biniam at Tegete hospital, and he get done. Dr. Mekonnen done her speech surgery, and then she came back and we worked on her speech, and she was very happy about it.
Cleft can be associated with rare craniofacial syndromes. For Dr. Francis, a child affected by a number of anomalies, including cleft lip and palate, springs to mind when I asked him about the cases that keep him motivated in this new work.
Actually, there are a number of stories to give, but I think I remember we have had a patient who is still under our treatment. Actually, this is a syndromic baby who was born with hydrocephalus and a very bad wide cleft lip and palate, and also with club feet. And actually, the mother was neglected by not only the husband who separated from her, but also the community. And this baby, when it came to us, was severely malnourished with the other medical conditions, including severe anemia and pneumonia too. So we received the baby in such a condition, and you can see that there is already a burden on the mother from the community and the family members, but also there's a huge burden to the baby who was almost dying because of medical condition. And this is only because they got late to the facility. So having a social worker and a psychologist on board, it was really somehow easy for us to engage with the community and the family members to help the parents, but also having a pediatrician on board and a nutritionist, it was easy to uplift the baby, like optimizing for surgeries. So we have been able to do both cleft lip and palate, and now we are also, the hydrocephalus was fixed. So we are now also moving with the baby, trying to get to the next phases of speech therapy and dental issues.
A complex diagnosis requires the strengths and expertise of a whole team. For Dr. Francis, this includes psychology, social work, speech therapy, and oral health. As we can hear, the conversation in East Africa is now much deeper than simply providing a safe surgery. What motivates them once a team is seeing children with cleft experience full rehabilitation. As we've heard, the cleft landscape in East Africa continues to evolve in exciting ways. Young professionals can clearly see the impact of comprehensive cleft care in the lives of their patients, and the opportunity to work in a team-based way is very motivating for these pioneers. Stay tuned for part 2 of this episode of Caring for Cleft, where we'll dive into the key challenges that CCC teams face in building new models of care, the central role that collaboration plays in overcoming these obstacles, as well as our guests' animating visions for the future.
This conference, actually, it was about sharing experience, how we can work together between speech therapists and surgeons regarding cleft care. And we learned a lot of things there.
I'm your host, Hugh Brewster. Thanks for listening today. Caring for Cleft is produced by Christian Wykes and Dedek Robertson and is edited by Sahil Ali. In the next episode, we'll hear more from our guests, Wedise Mekonnen Adam Mang'ombe, Dr. Getaw Alamne, and Dr. Francis Tegete. Before we sign off, may I ask you a favor? If you are a regular podcast listener, you'll have heard the request to like and share and subscribe, but this is especially true for Caring for Cleft. We're building this podcast specifically for people like you, and we would love your help in getting the word out. It really helps. Thanks.